Chlamydia and gonorrhea are the most commonly sexually transmitted infections in the US. Approximately 1.8 million cases of chlamydia and more than 600,000 cases of gonorrhea were reported to the CDC in 2019. Hello everyone and welcome back to the channel. If you are new here, I'm Doc ID, infectious disease physician, and we discuss different infectious disease topics on this channel. So don't forget to subscribe, like, and hit that notification button. So let's jump right into it. Today we're going to talk about this article that came out in JAMA in September of 2021 about screening for chlamydia and gonorrhea by the US Preventative Services Task Force. The rate of chlamydia infection among women is nearly double the rate among men. 698 cases per 100,000 for women versus 399 cases per 100,000 for men. Gonorrhea infection, however, is much more prevalent in men, 224 cases per 100,000, and women have 152 cases per 100,000. Infection rates are highest among adolescents and young adults in both sexes. Yes, I'm going to repeat that again. Infection rates are highest among young adolescents and young adults. In 2019, almost 61% of all reported chlamydia infections, and in 2019, more than 54% of new gonococcal infections were among persons between the ages of 15 and 24. Yes, 15 and 24. Chlamydia and gonococcal infections in women are usually asymptomatic, so it can lead to pelvic inflammatory disease and its associated complications, which can include ectopic pregnancy, infertility, and chronic pelvic pain. Newborns of pregnant people with untreated infection, again it's asymptomatic, may develop neonatal chlamydia and pneumonia or ophthalmia. Infection in men can lead to urethritis and epididymitis. Men are often asymptomatic. However, gonorrhea is more likely to cause symptoms in men than in women. Again, both types of infection can increase the risk of HIV. So, what does the US Preventative Services Task Force recommend? For chlamydia, they recommend that for sexually active women, including pregnant persons, we need to screen for chlamydia if they are 24 years or younger, no matter what happens, or 25 years or older, but they are at increased risk of infection. And I'll go over that later with what that increased risk of infection means. Then we screen for gonorrhea, again, if they're 24 years or younger and 25 years or older, and again at increased risk of infection, similar to chlamydia. For sexually active men, the US Preventative Services Task Force found the evidence is insufficient to assess the balance of benefits and harms of screening for chlamydia and gonorrhea in men. They're saying that they need more research for that. So, to whom does this recommendation apply to? Sexually active adolescents and adults, including pregnant persons without symptoms and signs of chlamydia or gonorrhea infection. So how do you implement this recommendation? Well, first, you assess the risk. If it's a woman aged between 15 to 24, they have the highest infection rates. If the woman is 25 years or older and at increased risk, for example, if they have a previous or coexisting sexually transmitted infection, new or more than one sex partner, a sex partner having sex with other partners at the same time, a sex partner with a sexually transmitted infection, inconsistent condom use, when you're in a mutually monogamous relationship, or a history of exchanging sex for money or drugs. History of incarceration is another risk factor. Secondly, we screen for chlamydia and gonorrhea in sexually active women. Again, that is 24 years or younger. I know you've been hearing this, but that's the point, 15 to 24. And again, women age 25 and older, you want to assess the increased risk. So what kind of screening test do we use? Well, we use the Nucleic Acid Amplification test, also known as NATS, for chlamydia and gonorrhea infections. That is usually commonly used. You can test for infection at urogenital and extragenital sites, including the urine, endocervical, vaginal, male urethral, rectal, and pharyngeal. In our office, we usually send out a urine for amplified DNA for chlamydia and gonorrhea. Both chlamydia and gonorrhea can be tested on the same specimen. Now, once you get your results, obviously treatment is as per diagnosis. So lots of benefits in doing the screening, as it was associated with a reduced risk of pelvic inflammatory disease versus no screening. Also had benefit with treating pregnant females with chlamydial infection. So they have improved outcomes for infants and mothers. So these are the recommendations for the U.S. Preventative Services Task Force for screening for chlamydia and gonorrhea. We do have some recommendations similar on the CDC and the American College of Obstetricians and Gynecologists as well. So this ends our lecture today. Don't forget to subscribe and like that button, and we will see you in our next lectures.